Welcome back, everyone. I'm Dr. Khan, and today we're diving into the body's ultimate security system. If the brain and spinal cord are the crown jewels of the human body, the meninges are the high-tech vault, the bubble wrap, and the anchor, all rolled into one. I'm joined by the ever-precise Dr. Sarah. Ready to peel back the layers?
Absolutely, Dr. Khan. While you see a security system, I see three distinct connective tissue membranes that students must master for their STEP exams. We are talking about the dura mater, the arachnoid mater, and the pia mater. They don't just sit there, they protect, anchor, and even facilitate the circulation of cerebrospinal fluid, or CSF.
I love the names. Mater is Latin for mother, right? So we're talking about the tough mother, the spider-like mother, and the gentle mother. Let's start with the dura. It's the outermost layer, and man, is it rugged. I always tell my students to think of the dura like a heavy-duty leather jacket protecting the brain.
That leather jacket analogy is perfect because the dura is composed of dense, fibrous connective tissue. For the boards, remember it's actually two layers in the cranium, the periosteal layer, which sticks to the bone, and the inner meningeal layer. Why does this matter clinically, Dr. Khan?
It matters because of the spaces those layers create. Think about a patient coming into the ER after a baseball bat to the side of the head, specifically the terion. If they rupture the middle meningeal artery, blood collects between the skull and the dura. That's your classic epidural hematoma. On a CT, it looks like a convex lens. It's a surgical emergency because that leather jacket doesn't stretch, so the blood starts squishing the brain instead.
Great point. And contrast that with a subdural hematoma, which happens in the potential space between the dura and the arachnoid. That's usually a venous bleed from bridging veins, often seen in elderly patients or chronic alcoholics. On imaging, that one looks like a crescent moon, not a lens. That's a high-yield distinction you'll see on almost every neuro exam.
Crescent versus lens. Classic. Okay, let's move deeper. Dr. Sarah, tell us about the arachnoid mater. This is the one that gives people a bit of a creepy crawly vibe, right?
Exactly. The arachnoid gets its name because of the arachnoid trabeculae, these delicate web-like strands of connective tissue that extend down to the next layer. It's avascular and sits right beneath the dura. But the real star of the show here isn't the membrane itself, it's the subarachnoid space.
Now we're talking. The subarachnoid space is like the moat around the castle. It's filled with CSF. Why does this matter clinically? Because this is where the major arteries of the brain live. If one of those, like a berry aneurysm in the circle of Willis, pops, you get a subarachnoid hemorrhage. Patients describe it as the worst headache of my life.
And from a diagnostic perspective, if you perform a lumbar puncture to check for blood or infection, you are inserting that needle into the subarachnoid space. You're looking for that spider web area to get a clean sample of CSF. You want to be the doctor of choice for your patients by knowing exactly where that needle is going.
Spoken like a true academic. So we have the leather jacket, the spider web, and then we hit the pia mater. I call this the shrink wrap layer. Dr. Sarah, how do you describe it to your students?
The pia is the gentle mother. It is incredibly thin and highly vascular. Unlike the other two, the pia mater follows every single contour of the brain. It dives into every sulcus and covers every gyrus. You can't actually scrape it off the brain surface in a cadaver lab without damaging the neural tissue. It's that intimate.
It's like the skin on a grape. It's so thin you barely see it, but it's holding everything together. Now, we have to mention the anchoring. The meninges don't just wrap the brain, they stabilize it. Within the spinal cord, the pia mater actually forms these little teeth, the denticulate ligaments, that anchor the cord to the dura so it doesn't bounce around like a loose cable when you jump.
That's a big one for anatomy practicals. But let's look at the big picture, meningitis. This is the clinical why for this entire topic. Dr. Khan, when you see a patient with suspected meningitis, what's happening to these layers?
It's total chaos. Whether it's bacterial or viral, those membranes get inflamed. Because they are packed with sensory nerves, especially the dura, that inflammation causes excruciating pain. That's why you get the nuchal rigidity or stiff neck. If you try to stretch those inflamed meninges by bending the neck, the patient's body screams no.
High-yield fact for the boards, the dura is primarily innervated by the trigeminal nerve, CN5, in the anterior and middle cranial fossae. Irritation there is what leads to that referred pain we call a headache. Also, don't forget that the meninges are derived from the neural crest and mesoderm during development. If you see a question about embryology, keep that in your back pocket.
Leather jacket, spider web, shrink wrap. It's a beautiful system. But before we wrap up, Sarah, if you had to give one gold star fact for someone taking an exam tomorrow, what would it be?
It would be the location of the bleeds. Epidural is an arterial bleed above the dura, lens-shaped. Subdural is a venous bleed below the dura, crescent-shaped. Subarachnoid is an arterial bleed in the CSF space, the worst headache. Master those three and you've got half the neuro questions in the bag.
And clinically, remember, the meninges are there to anchor and protect. When that protection fails, whether through trauma or infection, it's a race against time to save the neural tissue underneath. Great session today, Dr. Sarah.
In summary, the meninges are three layers, dura, arachnoid, and pia, that serve as the primary protective and circulatory framework for the CNS. Know your spaces, know your vessel types, and you'll be set for the boards and the wards.